So for understanding psoriasis, my first question is to you is what is exactly psoriasis and how does it affect the quality of life of a patient? So that's my first question to you.
Psoriasis is a skin disease that we call it as an inflammatory dermatosis. That means there's a lot of inflammation. It is not caused by any germs, not caused by any infection. It's an inflammatory condition which has got a strong genetic and immunological background. In this disease, though skin is affected, it can also involve other organs, especially joints. Because it's an inflammatory condition, it produces reddish and scaling patches on certain parts of the body, but predominantly over the head, or the back area, lower back area, elbows, knees. But having said that, it can involve entire body surface when we call it as erythrodermic psoriasis. So this disease, as I explained, it can affect anybody because it's not an infection or is not caused due to some nutritional deficiency or anything, but it's primarily affect people with some amount of genetic background, but it can also worsen due to poor lifestyle, especially obesity, smoking, and certain other things which have got certain evidences to say that it may trigger psoriasis. Certain infections may also trigger psoriasis.
And how does it affect a patient's quality of life? In what manner, to what extent the patient is affected?
Psoriasis is a disease which definitely annoys anybody because it's chronic. It's not going to resolve. So if it's an infection, it would just resolve once you give an antibiotic, antiviral, or whatever therapy. But that's not going to happen with psoriasis. Psoriasis is a chronic condition. Sometimes the disease can persist for months, years, sometimes lifetime also. So that's the most difficult aspect about psoriasis. Most of the times when we diagnose psoriasis, their confidence is down because they know that they are actually into a disease which is going to persist lifetime. And second part about psoriasis is the visibility of the lesions. They're reddish, scaling. Sometimes they feel very uncomfortable with carrying those lesions. They try to cover them with the full sleeve dresses and as far as possible. But even then, sometimes the disease cannot be hidden. Number three, there are associated symptoms like itching and scaling. A lot of scales fall. And, when they get up in the morning, they see a large amount of scales on the bed sheets. That's very, very disturbing for a patient who suffers from that. And the fourth thing, as I mentioned, it can have sometimes internal problems, especially joint pains. As I said, obesity can be a trigger for psoriasis. Psoriasis can be a trigger for obesity. A person with psoriasis can have poor general health also, especially obesity. And they also are prone to develop what is called metabolic syndrome, because of which the chances of developing cardiac events, the heart diseases also increases. So all those aspects contribute to the poor quality of life of a person who's suffering from psoriasis.
So what treatment options are available for psoriasis, like including conventional therapies, topical treatments, and oral DMARDs? So what are the treatment options available?
The treatment for a patient with psoriasis depends on severity, is not just the extent of the disease. It's not just the extent of the disease. It also means what it means to the patient. Many times, a patient with a relatively milder disease, say about 5% of the body surface area, may have a very strong psychological impact of the disease. So he may feel as if the sky has fallen. That kind of disturbed mental status a person with psoriasis can have. But having said, generally, more severe the disease is, poorer is the quality of life. And quality of life also depends on the type of employment, occupation that he's hosting. Even a mild disease sometimes may be, detrimental to his profession or the occupation that he's practicing. So we often classify the disease into mild, moderate, and severe. If it is mild, especially if the disease is less than 10% of the body surface area, we try to manage with the creams. A moderate disease, we generally give some form of internal medication. Severe disease generally warrants the use of internal medications. As you said, there are primarily creams which are called corticosteroids, vitamin D analogs, and certain other creams. We use a lot of moisturizers also to manage. And generally, we need these medications, especially the corticosteroids and vitamin D analogs, will have to be given on prescription alone, because these drugs cannot be used everywhere, entire body surface. We have to avoid in certain body surface body areas. And we also have to avoid its usage for a very long time, because they can have adverse effects. Because using a steroid cream on a larger surface area is as good as giving an internal tablet also, because a lot of steroid cream can get absorbed. Moisturizer, fine. One can use it, over the counter. They can use a lot of moisturizer. It will reduce the scaling. To an extent, it may reduce the inflammation associated with the disease. As far as the internal treatment or the systemic medications is concerned, we call contemporarily call them what is as the non-biologics, often known as the therapies which we have been practicing for several years or months, days when the biologics were not available. They are called as conventional treatment. In conventional treatment, we use anti-inflammatory compounds such as methotrexate or cyclosporin. They reduce the inflammation, but they generally do a lot of benefit to the patient. Especially, it can reduce the severity, and also it can give sometimes relatively long-term remissions. Then we also have what are called the biologics and small molecules. Now, as of now in India, we do have biologics available in India for the last few years. Having introduced biologics has made a lot of changes in the management of psoriasis, and they give generally a longer term remission, which means disease-free period, and also they act quickly. They bring down the severity of the disease much faster than a conventional therapies generally do. But having said that, both conventional therapy and biologics are relevant in the management of psoriasis as of now.
So you mentioned about biologics. So if we have to understand, how do they empower patients to live life limitless?
Yeah, to live life limitless, a person has to be absolutely free from the disease forever. So that is something which we cannot offer now. What we have with the limited treatment opportunities, options that we have, is to give a long-term remission, to bring down the severity of the disease. Somebody with the, what we call it as a PASI 90, if feasible, if not PASI 100 is not feasible, and to give a good quality of life, take care of the systemic comorbidities associated with this. So these are all the various objectives. If you ask me currently what are the drugs which are likely to address most of the objectives in the therapy, I think they are biologics. The reason is, number one, biologics, as I said earlier, they generally act faster. They bring down the severity of the disease much faster than other conventionals do. And number two, they can also induce long-term remission. That means you give the treatment for a certain period of time, say 4 months, 6 months, or whatever number of days, then you may actually discontinue and they may give a longer term remission, but it's not a cure. It's important to understand. So disease may come back, flares may come back, but they can give a long term remission, number two. Number three, compared to the conventionals, they may have a relatively lesser side effects, especially the internal side effects. When I'm talking about internal side effects, which means a renal toxicity, kidney toxicity, or a liver toxicity, or bone marrow toxicity, the chances are less. Having said that, no drug is devoid of any adverse effect. And it's also important to understand that when it is instituted by a qualified dermatologist, it definitely means the dermatologist is taking care of the adverse effects also. That means he knows when to predict, how to monitor these adverse effects, and the medicines treatments are given very wisely. So biologics definitely scores ahead of the conventional therapy in several aspects. There's no doubt about that. And that's why probably if you consider today, if you have something that can offer to a psoriasis patient, live life limitless, I think biologics are very close to that.
I think it's very important, and it establishes that it is helpful in daily life of the patients who are suffering from psoriasis. It basically improves their daily life as well. Moving on, sir, my further question is how important it is that regular doctor consultation and adherence to therapy in achieving a live life limitless lifestyle. There's the idea of it, how important it is that the regular consultation is there.
As I said, psoriasis is a chronic disease. It's important that the patient and doctor share some good chemistry. Only then the therapy can be successful. very important that the doctor also gives a good amount of time to the patient, explains what psoriasis is, what are the comorbidities, how important it is to be compliant with the therapy that we offer. Why compliance here? Because number one is that, it's not as simple that you give a cream, apply the cream, and the disease goes off. It doesn't happen that way. A treatment which was working yesterday, it may not work today. So that's why it needs to be, the therapy has to be tailored to the individual need at that given point of time. So based on the severity, based on the symptoms, based on the associated comorbidities and everything. And that can only be done by the presence of a person who understands psoriasis. The best person for that is a dermatologist. But at the same time, when the joint symptoms are severe, often dermatologists do take help from the rheumatologists, especially when there are more severe rheumatologic involvement in psoriasis. Dermatologists generally take a help from rheumatologists to manage the rheumatologic symptoms. So it's important that the patient be compliant, be regular in his visits. So initially the visits may be more frequent, but later on, once the disease is well under control or under remission, the visits need not be very frequent, maybe once in 3 months or even once in 6 months. So that is what is to be done. And when that is done, definitely the therapy outcomes are excellent. So it's important, that's my advice to the patients who are suffering from psoriasis, which is not small in number. It's definitely very big. Of late, I see a lot of psoriasis patients, mild disease, moderate disease, very severe disease. Everything is almost all types of patients we see. We see patients with comorbidities. We see patients with the obesity. We see patients with arthritis. We see patients with a lot of psychological comorbidities because of the disease. So all these things, it needs a comprehensive management. We need to advise on lifestyle management also. They have to lose weight. They have to have healthy eating practices. They should avoid smoking, alcoholism. And they should know when to use what medications, how they should use effectively the topical medications, when they should switch on to the internal medications. All these are definitely complex issues, which is only the patient's dermatologist can explain to the patient. And that's why it's very important that a long-standing relation should be built up between the psoriasis patients and the consultant dermatologist to have a good outcome for the therapy.
So you mentioned you included, that the patient should be able to, come to the doctor. What are the initial signs that they have to recognize if you have to, categorize?
So as I said, psoriasis is a disease, it initially manifests with the skin symptoms of reddish patches. Usually they come on the elbow and knees, sometimes on the scalp, but these are the common sites. They produce reddish patches and whitish scales on them. But having said, every disease with everything on the skin with red and scales is not psoriasis. We have several diseases which can mimic psoriasis. So it's important to understand. And then later on, it can slowly spread over other parts of the body. Similar lesions can appear in other parts of the body. Can have painful tendon insertions. That means where the muscle tendons insert, especially behind the ankle area. They can have pain in those areas. These are all the early signs of what is called rheumatological involvement or the joint involvement. So these needs to be recognized as the early symptoms, and accordingly, the patients will have to be managed.
So that was my last question to you. But we would like to know an end note that you would like to give on World Psoriasis Day.
Yeah, Psoriasis Day is observed in order to bring awareness among the public and also among the patients. Psoriasis is not as popular as many other non-communicable diseases like diabetes, hypertension, cardiac disease, or cancer. It's not as popular as, but it is definitely there, and it's in fairly big number in India as well. So it's important for the general public to aware that there is a disease which primarily involves the skin, but also involves the joints and certain other organs, and it needs to be taken care early. And having done that, and having taken care of the lifestyle and other things, it's a chronically manageable condition, and which can be managed to the satisfaction of the patients, especially in improving the quality of life. The current treatment in India are definitely much better as compared to, say, about 15 years ago, primarily due to the availability of the targeted therapies, especially biologics. And probably we are going to get such treatments which are targeted oriented biologics in many more numbers. As of now, we do have a fairly good number of biologics in India. Cost is the limit, but as the availability of what are called biosimilars, cost is also coming down as compared to what it used to be, say, about 5 years or 10 years ago. So as far as the therapy is concerned, treatment of psoriasis is concerned, in India, the dermatologists are in better position as compared to a decade or two ago. So with the available medications, with the current advice, combined with patients' compliance, we can definitely bring a smile on the patients who are suffering from psoriasis. So that's the message that I would like to give on this World Psoriasis Day.
Thank you so much, sir, for your insights on this topic.
Thank you, Aishwarya.